Another day, another story. Borderline personality disorder, BPD, is a mental health condition characterized by pervasive patterns of instability in emotions, self-image, relationships, and behavior. These patterns often lead to intense emotional pain, difficulties in functioning, and struggles in maintaining healthy relationships. Key features of BPD. Welcome to Tabo Eminent Channel. Emotional instability. Intense mood swings, often lasting hours to a few days. Interpersonal relationship challenges. Patterns of intense, unstable relationships marked by extremes of idealization and devaluation. E.g., thinking someone is perfect and then quickly seeing them as terrible. Fear of abandonment, which may lead to desperate efforts to avoid real or imagined separation. Self-image and identity issues. Unstable self-image or sense of self. Sudden shifts in goals, values, or opinions about oneself. Impulsive behaviors. Engaging in risky activities such as spending sprees, substance abuse, unsafe sex, or reckless driving. Self-harming behaviors or suicidal thoughts, actions. Chronic feelings of emptiness. Anger and aggression. Intense, often inappropriate anger or difficulty controlling anger. Dissociation and paranoia. Episodes of feeling disconnected from reality or oneself, especially during stress. Temporary paranoia or severe stress-related distortions in perception. Causes and risk factors. The exact cause of BPD is not fully understood, but it is believed to result from a combination of genetics, family history of BPD or other mental health disorders. Environmental factors. Traumatic childhood experiences such as abuse, neglect, or loss of caregivers. Brain structure and function. Differences in brain areas related to emotion regulation and impulsivity. Diagnosis. BPD is typically diagnosed by a mental health professional based on criteria outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. A thorough clinical interview and history are necessary. Treatment. While BPD can be challenging to treat, many individuals experience significant improvement with appropriate interventions such as psychotherapy, talk therapy, dialectical behavior therapy, DBT, focuses on teaching skills to manage emotions, reduce self-destructive behaviors, and improve relationships. Cognitive behavioral therapy, CBT, helps identify and change negative thought patterns. Mentalization-based therapy, MBT, aims to improve understanding of oneself and others. Medications. While no specific medication is approved for BPD, mood stabilizers, antidepressants, or antipsychotics may be prescribed to address specific symptoms. Support groups and education, peer support groups and psychoeducation for patients and families can be helpful. Borderline personality disorder, BPD, is not just a diagnosis. It's a deeply personal and often misunderstood experience that affects millions of individuals worldwide. Imagine living in a constant state of emotional turbulence, where the highs feel euphoric but fleeting, and the lows can feel like a bottomless pit. For someone with BPD, navigating daily life can feel like walking a tightrope without a safety net. A glimpse into life with BP. The fear of abandonment. At the heart of BPD is a profound fear of being left behind or unloved. This fear might stem from early life experiences, such as unstable family dynamics or traumatic events. For someone with BPD, even a simple delay in a text reply from a friend can trigger overwhelming anxiety and feelings of rejection. This emotional sensitivity often leads to frantic attempts to keep loved ones close, sometimes through behaviors that others might find intense or confusing. The push-pull of relationships. Relationships are both a source of comfort and turmoil for individuals with BPD. Picture falling head over heels for someone, idolizing them and placing them on a pedestal, only to feel crushing disappointment when they don't meet impossibly high expectations. This cycle of idealization and devaluation can create a roller coaster of emotions, leaving both the person with BPD and their loved ones feeling exhausted. The void inside. Many describe a persistent feeling of emptiness, as if a vital piece of their identity is missing. This void can make it hard to find lasting satisfaction in life's achievements or relationships. To fill this emptiness, some may turn to impulsive behaviors, such as excessive spending, substance use, or risky sexual encounters, seeking a temporary escape from their inner turmoil. A personal battle. Self-harm and suicidal thoughts are tragically common in those with BPD. These behaviors often arise from an overwhelming need to release or numb emotional pain. However, it's crucial to understand that these actions are not cries for attention, but rather desperate attempts to cope with feelings that seem unbearable. Moments of clarity. Mid the chaos, many individuals with BPD experience moments of deep self-awareness. They may recognize their patterns and genuinely want to change, but the path forward can feel daunting. This struggle for self-improvement is where the true resilience of those with BPD shines through. The complex lives behind borderline personality disorder, BPD affects people from all walks of life, and each person's experience is unique. Elenina's tale. The artist seeking connection, Lena, a talented painter in her late 30s, often poured her emotions onto canvas. Her work was vivid, chaotic, and hauntingly beautiful, a reflection of her inner world. Growing up, Elena felt like a burden to her emotionally distant parents. She carried this belief into adulthood, sabotaging friendships and romantic relationships out of fear they would leave her first. One night, after a heated argument with her partner, Elena impulsively packed her bags and left, convinced she was unwanted. But hours later, overwhelmed with regret, she returned, pleading for forgiveness. Her turning point came when a gallery owner, moved by her art, encouraged her to explore therapy. In dialectical behavior therapy, DBT, Elena learned to sit with her emotions instead of reacting impulsively. Slowly, her relationships stabilized. Her art continued to reflect her emotions, but now it carried a message of hope alongside the chaos. Marcus, the quiet fighter. Marcus, a 24-year-old college student, always felt like a chameleon, changing his personality to fit in with others. Inside, he felt empty, as though he didn't know who he truly was. Marcus's fear of abandonment was overwhelming. Even minor disagreements with friends made him panic. He would bombard them with messages, begging for reassurance, which often pushed people away. This left him feeling even more isolated. One night, after a particularly intense argument with his best friend, Marcus contemplated self-harm, but a late-night call to a crisis hotline saved him. The counselor listened without judgment and encouraged him to seek professional help. In therapy, Marcus discovered the roots of his insecurities and childhood neglect. With this understanding, he began to practice self-compassion. Joining a peer support group gave him a sense of belonging and helped him realize he wasn't alone in his struggles. Today, Marcus is working toward a degree in psychology, hoping to help others like him. The common thread: resilience. These stories reflect the challenges of living with a BPD, but also the incredible strength it takes to face those challenges. While the journey is not linear, recovery is possible with understanding, therapy, and support. Each individual story reminds us that hope is a powerful force, even in the darkest moments. Thanks for watching. Request you to subscribe the channel.